Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Tracy, there is little question that healthcare delivery in the U.S. is shifting toward virtual healthcare. Now, some, like today's guest, prefer to call it connected care or digital care. It refers to visits or interactions that take place between patients and clinicians over the telephone or some kind of video hookup. Patients, I think, are increasingly drawn to the concept of healthcare services that come to them rather than vice versa.
It makes sense to me.
Yeah, that sounds great.
Yeah, not that long ago, most health systems assumed that a quiet, private clinical setting was essential to the doctor-patient relationship, but not anymore. Joining us in studio is the director for Mayo Clinic Center for Connected Care, Dr. Steve Ommen. Welcome to the program. It's nice to see you again.
No, thank you for having me.
Dr. Ommen, nice to meet you.
Nice to meet you.
I know you know Tracy, but I haven't met you before, so it's great to have you on the program, particularly talking about what you like to refer to as connected care.
Yes.
So healthcare is changing, the world is changing, healthcare is changing, and there are a lot of names for what you call connected care, and it gets a little bit confusing. So do they all mean the same? Virtual, telemedicine, telehealth, digital health, and connected care?
I think there are probably definitions for each of them that make them sound different, but in the end, most people interpret them the same way. And you summarized it well. It's the ability for us as doctors and nurses and nurse practitioners to reach out to our patients where they're at to help take care of them. And that might be a conversation over phone. It might be a conversation with video so we can see facial expressions or see something move on the patient. It might be collecting data about that patient either through questionnaires or monitors that the patient is wearing or utilizing to send data back to the clinic so that we can use that to make decisions with the patient about what's right for them.
Well, it sounds fabulous. I mean, we've got listeners out there right now who are saying, well, I got a question for my doctor. So how do you access, what gives you the ability to do this, either by telephone or some video link?
Yeah, so there's several different ways. The one that's probably the least sexy but the most utilized is just sending messages to your doctors rather than playing phone tag with each other at the end of the day. So the ability to use the patient portal to send an update to your doctor, my blood pressure is higher than it used to be, or my shoulder isn't better today, and for the doctor or the appropriate team member on their team to get back to the patient in a good amount of time has made those interactions much less onerous on both sides. The way I look at it, it's similar to the way we all make dinner plans now. We always start off by sending a message to someone, hey, do you want to get together for dinner? If that's all that's needed and the answer is yes, then you're done. As soon as it gets complicated, then that escalates to something else. It's a phone call. Or it might even be, why don't we get together first and then make the plans for the weekend? So we're just trying to do the same thing with medicine that we're all used to doing culturally in many other aspects of our lives.
So explain, again, you're the director for Mayo Clinic Center for Connected Care. So it's its own office at Mayo Clinic. And what is the desire, or what is the hopes and dreams?
Yeah, so we are more than just a technology. We have a very skilled team that helps put together business cases for doing these type of interactions, the secure messages, or a video visit after you've had an operation at Mayo Clinic. Lawyers, compliance officers, implementation specialists. So our job is to work with the practice at Mayo Clinic, the doctors in their practices, to understand which of these tools might help you with your practice. For a surgeon, it might be doing video visits after the patient's had a surgery rather than making that patient come back hundreds of miles to see them for a routine follow-up visit. Now the surgeon can go to that patient's home virtually or digitally to see them and have that conversation, which saves the patients a lot of travel time, a lot of travel cost, and they provide the same level of care.
As the surgeon at the table here, what percentage of your patients do you think you could have successfully treated in a virtual sense?
I would suppose at least half, although sometimes our patients would come back for imaging because it was a cancer or it was a tumor and we would need to see them and they would need to come to the clinic. But for a wound check, for example, or to see how the range of motion is after a total knee, You could easily do that with a video. And do you use Skype? Is that the medium, or what's the medium?
Yeah, so there's special software that's utilized to have the data privacy issues we need and the HIPAA compliance. So we do have a vendor we work with that satisfies all those privacy security considerations. The ones that we all use in our personal lives, like Skype and FaceTime, et cetera, don't quite have the security or the reliability. We forget casually when the conversation drops on a call. If you're discussing someone's pathology result, you don't want to have the audio glitch on the word "not."
Mm-hmm.
Sure.
So we do a lot of stringent analysis of the endpoints as well as the software that connect us to our patients to help that work.
And what about regulatory issues? How do you circumvent those? And aren't there a fair number that are hard to get around?
Yeah, state to state, country to country.
Exactly. So in order to provide care to a patient where they're at, technically we need to be licensed where the patient is when they're getting that care. So that limits our ability to do new business. For me to do a consult with a patient who's never been to Mayo Clinic before, to reach across the state line or across a country line to do an intake or to provide care, we stay away from. What we can do in that circumstance, though, is have better record upload or information gathering about the patient to help optimize their time when they do come here.
Now, if they have been a patient here and they go home, then it's okay if I don't have a license in Illinois?
We've had our legal team review that, and they feel that is continuation of the care plan you set in place here. And it's what you've been doing on the phone for decades anyway, and having video doesn't change that bar.
So this is more broadly just saying it's for more follow-up care. What about initial visits? Is there any sort of future there?
There is a future there, and I do think that we are going to see that regulatory environment change. All kinds of legislators are talking to us about what do we need to do to help patients get better access for care. So that landmark will change over time. In terms of new visits, we do have a tool that we use called Express Care Online, where a patient who's already a Mayo Clinic patient can log on to the patient portal, and for the 20 most common primary care diagnoses, they can answer a few questions online. Within an hour, that is reviewed by a nurse practitioner that works in one of the Express Care clinics, and if appropriate, can issue a prescription for that patient based on the responses, all within that hour. The patient didn't have to leave school or work or home in order to get that done. So there is some opportunity to optimize care even at the front end.
And how would a patient access that?
That's through their Mayo Clinic patient online services.
And do lots of, not just Mayo Clinic, but are there patient portals for many patients? Is that gaining traction across the country?
Yeah, so most healthcare systems now have some version of a patient portal, usually tied to their electronic health record. The utilization of the Mayo Clinic portal is higher than average. We have about 2/3 to 3/4 of our patients using their portal around an episode of care at Mayo, which is at least twice what the national average is. So we have a team that works very hard with our patients to understand what features are you wanting. Is that working right for you? How do you get to the features you want as a patient?
That's about something about Minnesotans being overachievers. I don't know. Hey, so what is the future?
One more question before we get there. Reimbursement. Will Medicare, Medicaid, private insurance companies pay for these connected care visits?
There's all kinds of different rules around which types of visits are reimbursed and which ones might not be. Okay. One of the reasons why it's had such a good uptake in the surgical practice is because most operations are handled by a single bundle, which covers all the follow-up visits. So to do the follow-up visit by video that way makes sense because we don't have to worry about whether the patient's getting billed or et cetera, because it's already part of what they paid for their knee operation, for instance.
And it's also been said that healthcare is moving from a fee-based to a risk-based model. Is that what does that mean, and is that good for connected care?
I think, again, managing our patients around diagnoses and saying this is how much this care costs, and not worrying about line iteming each little thing that goes into that will be the move that will make this more adopted.
And what's the future?
Yeah, the future is utilizing data. So the ability for us to get data back from our patients, be that with a device I prescribed to the patient to take home, a blood pressure monitor, a scale that is Bluetooth connected, or now wearable devices that are monitoring heart rate, oxygen saturations. Even some electrolyte values can be determined by some of these sensors. Having that data flow back to our system, having some of our computing power, the artificial intelligence power, act on that data and give us advice about how to escalate or de-escalate a patient's care is the future of utilizing these connectivity options.
Well, we're just getting started.
Love it.
Dr. Steve Ommen is director for Mayo Clinic Center for Connected Care. I mean, it's like, beam me up, Scotty. Connected healthcare is here, and I love this line. The patient will see you now. And in the not too distant future, I think patients are likely to expect this as one way that they can interact with their healthcare providers. Our thanks to Dr. Steve Ommen.
Thank you.